All right, it's 6:18. I'm going to call this meeting to order. Eric, have you had time to look at the minutes from the prior meetings?
I mean, the one for the joint Board of Selectmen and Board of Health looked like it was truncated just to the decision about emergencies, at least the version I got.
Yep.
And as long as that's all we had to sign off on, I make a motion to approve the minutes from our meeting of March 2nd, and I make a motion to accept the joint meetings on our behalf of March 27th with the Board of Selectmen.
Okay, I'm just thrown off by these minutes, and maybe I've never seen this before, but it's identifying Eric and I as officers, and we are not officers. So we should be identified there as board members.
Oh, that's true. Yep.
Okay, I don't know whether that's been like that forever or whether I just picked up on it. All right, I'll second that motion to accept the minutes. Any further discussion? All in favor? Aye. All right. New business. Sue, part of the reason that I asked you to call this meeting was so that we could get an update on this COVID-19.
Mm-hmm.
You know, specifically what's going on in town.
So basically, as you know, as everybody knows, we've been dealing with COVID now for, I believe this is like week 8. I think that we've been involved. As far as the town of Chelmsford specifically, as of this afternoon around noontime, we have 269 confirmed cases. Of those 269, 139 of them remain active. And one of the things that I like to inform people of when we're talking about confirmed cases is that people need to understand that those cases that are confirmed that we're talking about, that 269, simply means the laboratory confirmed cases at DPH. There are many more cases that are out in the community that are not laboratory confirmed. And the reason we know that is because when we do a case follow-up, so every single confirmed case that comes through the lab, my department is following up on those cases as well as their close contacts. And we're providing them with the isolation and quarantine guidelines. We find out who their close contacts are so that we can get in touch with their close contacts and figure out when their quarantine dates have to be. We send them the isolation and quarantine information either through the mail or through email. And we ask them to monitor themselves and explain to them exactly what they need to do. Oftentimes, those contacts that have been identified that are in quarantine, at some point during that 14-day quarantine period, will all of a sudden start developing symptoms. And they are instructed to call their physician, and their physician may say to them, I'm not going to have you tested because you're presumed to be positive anyway, because we know that you're either a household contact or a very close contact of a positive case. So there's that whole group of cases out there that are actually positive per clinical diagnosis by their doctor that we can't track. So that's one of the things that we're trying to do as far as educating the community on the fact that this is out there. There is widespread community spread. It's been talked about by Governor Baker. It's talked about at the DPH level. We are also, all of that case follow-up right now. Last week, we got the assistance of 3 of the school nurses that are assisting myself, Darcy, and Amanda in all of the case follow-up, because it's quite involved with everything. All of the long-term care facilities in town, as well as the assisted living, are in very close contact with me almost daily, updating me on their status, what's going on in their facility. Between talking to myself, between talking to DPH, we provide them with whatever guidance they need on infection control and that type of thing. They're all doing a wonderful job with trying to contain this highly contagious virus. It's no secret, it's been all over the news that Palm Center was hit very hard. And I think there was an article this morning, I believe it was in the Boston Globe, that advertised that they had 29 deaths in their facility, in addition of residents, in addition to one of their employees. But they have been in touch with us from day one, and they've done everything they possibly can as far as infection control. I am working with the assisted livings right now, because one of the challenges that they have is that, unlike a nursing home, they don't have a medical director. So because they don't have a medical director, they can't get one order for the entire facility and the entire staff to get tested. They would have to get an individual doctor's order from every single resident in that facility. So they are working with the state, with myself, National Guard, and I've even discussed this with Dr. Meikle to get some of these areas tested.
Are they observing the social distancing?
They're doing everything they possibly can. So, for example, I'll use the atrium, for example. The residents have their own individual rooms. Whenever all staff is wearing masks the entire time. They're screened when they come through the door in the morning. Temperatures are being checked, a couple times.
Eric, can you still hear her?
I can hear you. I cannot hear Sue.
No, neither can I. She's gone. I don't know whether we can. She'll figure it out soon, I'm sure.
I'm going to text her to check her login.
Okay. There she is.
Sorry, I got knocked out for a minute.
Yeah.
So they're really doing what they're supposed to. We're hoping that within the next week we can get those assisted living places tested, all their staff.
So they are keeping their residents at the facility?
As best, yes. Yes, and they're doing as much social distancing as they can. I mean, so for example, the atrium, it's a facility for Alzheimer's people. So, you try to tell them that they kind of have to stay in their room for the majority of the time. But if they come wandering out, to have a mask if they're out of their room. So the staff is doing the best that they can.
Yeah, I guess I'm more concerned with them leaving the facility.
Yeah, nobody's leaving.
Okay,
Nobody's leaving.
Even at Summer Place?
Correct.
Okay.
Correct. And basically, so I spoke to Summer Place probably a week ago, and I asked them what their policy was, because they're independent living, so it's a little bit different. And their policy was that if a family member wanted to take one of their residents home, that they needed to understand, as long as that resident was negative, obviously, that they could go home with them, but they would not be coming back until COVID is over. And that's their policy.
I think that's a good policy, but you're right. That's more of a retirement home than it is assisted living.
Right.
Okay.
But they have things scheduled where if somebody wants to go out into the hallway and stuff like that, then they're contacting the help so that they're timing it correctly with other residents, because over there, I guess they can have small pets, like it has like small dogs.
Yeah,
and stuff.
they can. Yeah.
So if you want to take your dog out, they're controlling it with their staff that, people aren't in the hallway at the same time and crossing paths and stuff like that. So they're all, I have to say, they're all really doing their part. As you well know, Governor Baker on Friday signed the order in place for mandatory masks, and that goes into effect this Wednesday. Enforcement is basically projected by the Board of Health and law enforcement. We're not out to try to take anybody's, first.
Sue?
Sue, if you can hear us, you froze.
Not sure she can hear us, Eric.
I know, I'm texting her.
Yeah. You're quick on the draw there.
Looks like she's, oh, you're back.
Sorry.
Okay.
So where'd you lose me? At the mask?
Yes,
the
you're
order.
talking about enforcement.
So the enforcement is going to be Board of Health and law enforcement. There is a civil ticket procedure in place if necessary. We're hoping we don't have to use that. If people are stopped because they are in a public place and they don't have a mask on, especially for the first week, we will remind people that there's a mandatory order in place by the governor and they'll have to put a mask on. Some of the sergeants will have a few extra masks in their car if somebody says they don't have one, but we encourage people, you can get masks anywhere. You can use a bandana, you make one out of a shirt. There's all over YouTube, you can figure out ways to make a mask for a face covering.
Now, this includes any activity outside?
Yes, so.
Within 6 feet.
Right, so for example, we get repeated complaints up to this point all the time on the bike path.
Yeah.
Anybody that is going on the bike path starting this Wednesday moving forward will have to wear a mask because the bike path itself is only 10 feet wide. So
right.
Even if you have two people passing each other on either corner, it's not 6 feet. So people will, in any public places, the grocery stores, the pharmacies, anything like that, people will have to wear a mask. The stores are supposed to enforce not allowing people in unless they have a mask. All the employees within the store will have to have a mask. And the only people who don't have to wear masks are obviously children 2 and under, or any.
You're still here.
Okay, I thought I lost you again.
No, yes, we'll let you know.
Just see my frustrated face.
I did.
Oh no, don't tell me I got knocked out again. And if someone has a medical condition that they don't have to wear a mask. So that would be the only people that aren't going to be allowed, that don't have to wear them in public.
So if you're out at 5 a.m. in the morning taking a walk and there's nobody around, do you have to have a mask on?
If you're by yourself and you walk in your neighborhood,
yeah,
I would say no.
Okay, but if you see somebody coming, you either have to get out of the way or put a mask on.
Yeah. Because you're essentially, if you're out in the morning, 5:30, 6 o'clock in the morning, you're taking a walk through your neighborhood, you're not near anybody else. You're not within 6 feet of anybody else, so you are social distancing.
Okay.
So you wouldn't have to wear a mask at that point. We are still continuing to get some people who are complaining about the fact that, the tennis courts are closed and other.
Forgive me, Sue. Can we go back to the mask for one moment, just to clarify? Was the under 2 does not have to wear it?
Correct.
And the other one is people have medical conditions. And so to make it clear that, if somebody has asthma, they should not be, they're not required to wear it because the increased work of breathing with it, or COPD would be another one. And the other thing that goes along with this is that if somebody's wearing a mask and they get into their own car, they should take it off because there's an increased work of breathing, there's an increased carbon dioxide, and there are now reported cases where people who have been wearing it for a prolonged period of time went to drive home, didn't take it off, and crashed the car. So that if you're alone, take the thing off. But if if you might be within 6 feet of somebody, store, bike trail, anything, you wear your mask when you're outside your own home.
Yes.
Okay.
Thank you for that clarification. And the other thing that people have to remember is they still have to wash their hands, use sanitizer, still continue to do the social distancing. Just because people have masks on doesn't undermine all of those other precautions moving forward. So that's a huge message that we want to get out to the community as well.
Well, what about gloves, Sue?
Gloves, people can wear gloves. Like, people go hot and cold with wearing gloves. Like if you see them in the grocery store shopping, whatever. I can honestly sit here and say I have not been in a grocery store because clearly I'm in high risk, but I understand that some people wear gloves every time they walk in, and the key is to dispose of them properly. If you're coming out of the store, take your gloves off, throw them in the trash barrel. Don't throw them on the ground. Don't throw them in your car, and then still use hand sanitizer. Unfortunately, I think people think because they have gloves on, they don't think about the fact that they've touched everything. And then they go to take the gloves off, and now all the germs are, on their hands, and they don't use sanitizer. So that's an important thing too.
And the gloves are really going to protect the person who's wearing them, because if you don't want to pick up stuff from the environment, you wear gloves. But if you touch two people, you haven't protected those two people. You've just transferred it via the glove as opposed to via skin. Right. And the one people bump into is that the integrity of the gloves, if somebody's going to wear it and wash it, especially if they're going to use some sort of caustic material, it might degrade the glove, at which point it loses its value anyhow. Mm-hmm. So that's why I have a little bit more trouble. If you're going to protect yourself from money or whatever, it's one thing, but you're not necessarily protecting the environment when you deal with multiple people.
Right. Bless you, Anne-Marie.
Thank you. Thank you, Eric.
Thank you. I did get a request over the weekend. I haven't had a chance to respond regarding, tennis courts from a resident. And I did bring it up at our emergency team meeting today. And the general consensus and the whole reason that they were included in the closures with the playgrounds and that type of thing was basically because Chief Spinney was getting complaints about gatherings and, people weren't social distancing and all that. We just had to put some things in place to try to prevent that from happening. It's going to get more and more difficult as the weather continues to get nicer because people want to be outside and together. But basically, we still are technically in a stay-at-home order. And we're still under, 10 people or less, the 6 foot and all that. And I think what's probably going to happen is come the 18th, the anticipation is such that Governor Baker will start to provide some guidance on what the stages are going to be for us to start reopening, if you will. And that guidance will come from the governor. And until such time, we are just going to continue to leave those places closed because it does fall under leisure activity. And though I understand people want to get exercise and this and that, but for right now, even though you are technically 6 feet away when you play tennis, it's the other people that are using the courts for not playing tennis. So we're going to keep that as is for now, and that was a joint decision by the entire team. I do meet on a daily basis, daily Zoom calls with our emergency team, and that team consists of the town manager, the assistant town manager, our emergency management director, myself, the fire chief, and the police chief. And each of us just kind of updates each other as to what's going on, and then we're planning accordingly. As of today, I'm part of several different teams throughout town hall, the library, the senior center, DPW, and we're starting to have our discussions because we have to start planning on what's going to happen as we start to reopen. What is the plan going to be? It's not all of a sudden going to be, okay, unlock town hall, open it to the public again. I'm sure it's going to be the wearing of masks. We're still going to have to do the 6 foot distance. So all of those town buildings are also going to have to comply with all of that. We'll have to mark the floors. There'll have to be some offices and different places are going to need barriers set up in order to do the whole shielding, just like they're doing in the stores and that type of thing. So, we do get complaints all the time. I try to handle them. My staff is really good about handling the complaints as best we can. We're not going to make everybody happy, and I feel bad for that. I wish I could make everybody happy, but we really are trying to do the best we can in the interest of public health during this pandemic, which is completely unprecedented. We've never been through this before. And we rely a lot on recommendations from DPH and CDC.
Okay. So the 269 cases in town, any common denominator?
So out of, I would say, other than the concentrated cases that we did have, as you know, people know about, Palm Center was hit pretty badly.
Right.
So they were hit, you know, they were hit significantly. Other than those, that one cluster of quite a few patients, no rhyme or reason. It is all over town. And the other thing, which is interesting, is that, you know, initially, DPH CDC talked about, you know, the over 60 and the high risk and all that. And although that is still a, you know, a high risk category, we have seen cases from children right through the elderly. So, and we've had a lot of cases that are under the age of 60. So it's not just concentrated.
Eric, what are you seeing in your practice?
It's really mixed. It's in a lot of cases, people actually know who they were exposed to, but it's not like they all came from Biogen. And it's not like that it could be anything from another child to the age that they were exposed to varies as well. So it hasn't been really worth it to try to find a pattern to it. It just gets almost anybody. The issue has been the severity with the older people are, the tends to be the more severe that they have it, or if they have diabetes, high blood pressure, respiratory disease, heart disease, that makes them higher risk. So
I
have a question.
don't know where I cut out again the last time, but I just wanted to say that a lot of our cases have not been over 60, that we've run the gamut from very young to very old.
What do you mean by very young? What's the youngest?
3 weeks.
3 weeks.
3
Yeah.
weeks. 3 weeks to my oldest, 101.
Yeah, on the pediatric end of the spectrum, I have several kids under a year old that we've diagnosed. Sometimes by testing, and sometimes because, like you said, if the uncle's positive and the kid's got symptoms, and then it's a presumptive case, we don't necessarily send that one for testing because that would just potentially stress the child, expose the child to more, expose other people to the child. You know that you're going to isolate the patient until they are symptom-free for the required period of time.
Okay.
So a quick question for you. With regard to recreational facilities, once we sort of move to the next stage, be that May 18th or otherwise, there's a distinction, I think, that if everybody's wearing a mask, playgrounds, dog park, tennis courts, one thing to remember about like a playground, it's a little bit unique in that kids under 2 years old are not required and are not going to wear their masks properly. Right. So even as we start to, once we're safe to consider the other facilities with adults, I don't know if you need to put any age restrictions on them or just know by the way that they're used that we're a little bit more freer there than we are with the playgrounds. Playgrounds are where kids go are special, are unique places that way.
Right, right. And I think that the plan for the committee too, I believe, is to, base it on what DPH, CDC recommends, what the governor's recommendation is going to be moving forward. And I also think that, like in Paul's case as the town manager, he's also in contact with, members of his Mass Municipal group and what other communities are doing. And so everybody's kind of talking to each other.
Okay.
I think that's it for me, unless you have any other questions.
No, I don't think so.
In terms of the community, with the COVID, right now, because the hospitals ended the elective procedures, they have a couple extra units that they're using for ICU space. Their numbers have been pretty consistent over the last 3 weeks. They do have additional ICU beds. They do have plenty of ventilators available, and they still have all the spaces over at UMass Lowell that they can move patients into if need be. That they're still not doing elective procedures, but they're good. They have capacity to take care of any further surges we have locally.
Okay. Hey, Sue, what about the daycares in town? I mean, the one next to my law office seems to be open.
So specific daycares are opened if they have been cleared by the state to, excuse me, to take care of children of essential workers only. So for example, I actually had a discussion today with Knowledge Beginnings, because Knowledge Beginnings, right near your office, is open as for essential service workers only. And their concern today, the reason they reached out, was how they were going to be able to handle this whole mask thing with kids, because the majority of their kids are they have a couple kids under 2, but majority of their kids are between 2 and 8. So it's going to be difficult to try to keep a mask on a child that, is 3 to 8 years old. And so we just kind of discussed other ways. Number one, they can't social distance when you're doing daycare because you have to be close to the kids. And what they've been doing so far is parents have not been entering the building. They've been dropping them off. Parents have to have a mask on. The staff brings the child out. They've been implementing just tons and tons of hand washing, which they're going to continue to do, as well as extra sanitizing. And they've got 2 rooms open at their daycare. So they can take quite a few kids of essential workers. I think one room, I think they said they could hold 10 kids. In the other room, they could hold up to 20.
Is that the only facility in town that's open?
No, there was another facility on North Road that is actually being run and managed by the YMCA. And that's very low numbers. I think the highest number of kids they have there is 10. But those are the 2 that I know of that have been in touch with me at this point.
Okay. All right. And you're not seeing anything coming out of those facilities?
No, knock on wood.
Yeah.
And that's what I said to the director over at Knowledge Beginnings today. I said, the good news is whatever they've been doing, they're doing a good job. And I said, keep doing what you're doing, because clearly, knock on wood, they've been able to not have any cases there.
What about these at-home daycares? I mean,
those are not supposed to be running.
Right. And we have no way of monitoring that.
The only way that we would know is if somebody drops a dime on them. And then if we get a phone call or if we get an email in the office, we do follow up. For example, we had a complaint about somebody who was cutting hair out of their home, and they were having their clients come to their house. And of course, that's not an essential service and it's against the mandate. So we called, we connected, basically told them, you need to cease and desist immediately because you're not an essential service. And most of the time, as much as people don't like it, they will stop. We had to do a discussion with 2 different areas that were pet groomers, and that's not considered an essential service either. And we had to tell them that they had to close as well, even though they were really trying to do things the right way. They were doing social distancing. They were only allowing, they were picking the animals up at the door and not allowing people into close quarters, but it's not an essential service.
Right.
I actually just got notification today. I thought this was interesting. So Michael's department store was being looked into probably a month ago as a non-essential place. And they voluntarily closed, but then they appealed to the Attorney General's office. And the Attorney General just made a decision that they can be open in order to sell fabric and anything that is necessary to make masks or other PPE, and that's all they should be open for.
They're selling a lot of sewing machines.
I'm sure they are.
Yeah. So I also understand that TJ Maxx is opening back up.
Oh, I haven't heard that yet.
Yeah, I got an email from them yesterday.
Really?
Yeah, and I put the zip code in and came up that the Chelmsford one was opening.
Okay, that's news to me, Emery.
Okay.
Okay, I'll have to look into that. Under what premise? I mean, they had a cease and desist order to Kohl's in the last.
They didn't talk about under what color of law. They just said that they were opening. Now, again, they said to search by your zip code. I put my zip code in, and Westford came up and Chelmsford came up. So it led me to believe that the one in Chelmsford was opening again.
Did they put a date in there or no?
No.
Okay.
No.
All right. Well, we'll have to keep an eye on it. And I'm sure because of the way that Market Basket is functioning right now with their line to get in and 6 feet apart for everybody, and everybody lines up, along that whole area underneath. I'm sure that if they're open and somebody in the community doesn't believe they should be, they'll let us know.
I'm sure they will. I'm sure they will. Okay.
So we'll follow up on that.
All right. I think that's about all I had on my mind. How about you, Eric?
I do worry a little bit about the fact that a lot of the kids that we're seeing that do have COVID-19 have next to no symptoms or really minor, maybe a little drip to the nose or something. So that the same goes for dogs. I've heard that I don't think they've shown spread from dogs to humans, but there's been a couple of dogs that have tested positive out there. So I guess it actually applies more to the cats that they're now suspecting. But a lot of the cats that do have it have minimal symptoms. So that when we talk about the daycare, the fact that they haven't had anybody that came down with overt symptoms, there could still be some potential spread. We'll just have to sort of keep a pulse on that. These are essential workers, and their kids need to go someplace. And the other thing that came to mind as Sue was talking is just the fact that as we do this, we are in a border region, and that already in Maine, although when they reopened the hair salons on Friday, that they were explicitly not supposed to be taking care of anybody other than Mainers. The ones in Kittery said that half their business was people from Massachusetts desperately running up there because there's a place that was open. And as New Hampshire, which when I drove up there yesterday, had signs outside that if you're coming to New Hampshire to stay, please quarantine yourself for 14 days. But they're moving ahead with plans to open up so that if they start having outbreaks, how is that going to affect us?
Mm-hmm.
So I guess, if people are going up there on shopping trips, they're not intending to stay. So they're not going to heed any quarantine.
Yeah.
It'll be interesting to see how New Hampshire, if it opens before us, handles that.
I'm hoping we've been sort of at a plateau in the area for a little while here. They said that the plateau for the Spanish flu lasted in New York for like 6 or 9 months. My hope is that it's about to drop off, and if people time it right, we're lucky, and if we time it wrong, we could have a couple nasty surprises like Philadelphia did back in 1918 with the second spike.
Mm-hmm.
So.
Okay. All right. I'm going to suggest that we bypass the old business that's on the agenda.
Okay.
Give them a little more time.
Mm-hmm.
And other than that, unless there's something else, I was very interested in having this meeting so that we could get some of this information out to the public.
Mm-hmm.
So Sue, I don't know if there's anything else you want the public to know, or Eric, there's anything else you need them to know?
I don't think so from my perspective. I just want people to know from, the Board of Health perspective that we truly, as a group, are really trying to keep the community's health, in the forefront. We're doing the best that we can, and we are following DPH and CDC guidelines. And some of the things that we're doing, we're not just doing just because. It's because of the guidelines and what we're being recommended to do. And at the same time, if people have questions, if people have concerns, we are taking the phone calls, we are answering emails. We may not get back to somebody's email that same day because we are incredibly busy, but we are doing the best that we can. And we're even trying to continue the office as best we can with normal activities. I mean, this is our time of year where we have to renew all of the food establishment licenses and all of that. So kudos to Donna. She's done a great job with sending all of those out, all of those applications out electronically. We are getting those back in to issue people permits. So we are trying to do other things in addition to just COVID-19.
Okay. Eric?
The only thing that I would add, and it's not directly the COVID-19, but when everybody stays home, there's the potential for kids to fall behind on their vaccines. And the problem with that is that I've never seen diphtheria. I've never actually seen measles myself. And all the pediatric practices in the region, so it's not just Chelmsford, but all of Greater Lowell, we are all vaccinating our children under 2 years old so that they've had all those vaccines for the diseases that we don't want to see come back as a result of this new disease.
Okay, so Sue, as we have businesses opening, if the governor is to permit that, I would imagine that there's still going to be the social distancing and there's still going to be the masks. So even within a business, like at my firm, when people come in, we tell them they can't come in unless they're masked and they have gloves on. And we put the plexiglass up, and we have a special, what we call safe room, that we meet to people to execute documents where they're separated from us. And I imagine those kind of things are going to have to be maintained even when we start opening up, even though so businesses have got to keep that in mind also. Yes,
and moving forward, especially the businesses so restaurants, for example, I believe is it New Hampshire or Maine that as part of their opening, I believe that they are starting with businesses that have an outdoor seating area so that people can be outside. The workers have to wear their masks, and even the patrons aren't supposed to take their masks off until they're actually physically ready to eat. And those tables still have to be, 6 feet apart and stuff like that. So I think it's definitely going to be gradual, step by step. And we're just going to, work with the community, work with the businesses. I feel for a lot of businesses that have been really hurting through all of this. So I'm hoping that, we can get things open. And I think as long as whatever guidance is put forward as we do open, if people do follow the wear the mask rule and stuff like that, to try to keep the cases at bay and not try to prevent a huge spike, that it will work if people comply with the guidance. And I think that's what we're hoping. I'm hoping that between now and maybe the next couple of days that the governor does something about florists and maybe allow them to do some kind of a curbside pickup with Mother's Day next week, because I'm sure that this is a huge busy time of year for them that they're losing out on. But if there is any guidance, they would just have to, go by whatever guidance is provided.
Mm-hmm. Yeah. Is Mother's Day Sunday?
Yeah.
Yeah. So there'll be some social gatherings.
I know. Well, just like this past weekend, we received emails with photos and people, kind of reporting that other people were not social distancing. And but again, we can't be everywhere at once, and we really have to rely on each individual person to do their part.
Right.
And we do follow up on the complaints as best we can, but
and you do have families that live together, work together, and what do they call them? Pods now.
Yeah.
They're like pods, and they're segregating themselves among themselves.
Right.
They, like I said, they work together, they live together,
Right. And there's still that the order about under 10 people.
Right. So even if you have it,
if you have family over and it's under 10, you're still recommended to keep your 6 foot distance.
Right.
But those are the things that individuals can do to help themselves,
Right.
as well as the community.
Okay.
Yeah, when people go back, it's not like when the stay-at-home order is lifted that everything's going to go right back the way it was. If and when we have a vaccine and enough people are vaccinated, then there's a chance. But until then, there's going to be spacing and masks and everything. And I think the other thing is that when they opened up the restaurant in South Carolina, they were about full because people still are going to have concerns that they might catch it, even if it's not mandated they stay home by the.
Yeah. Yeah, I can see that. So, okay.
I was just going to say, for example, with the flowers, the other problem there is there are no flowers. In the Netherlands, they export like 80% of our flowers from one country, and they threw them all away. And they weren't on the airplanes. They're not the florist shops to be sent out, unfortunately. So
Yeah.
there's a lot of repercussion.
Yeah.
Yeah. So what is the story with sending things, flowers and boxes and things like that? What's the
We had a brief discussion when we had the joint meeting with the Board of Selectmen that about 6 weeks ago, the New England Journal of Medicine did a study and put out how long the virus lives on different materials. And the short answer is that if it's a soft fibrous material, the answer is about 2 to 3 hours. And if it is a hard material, plastic or metal, it's more like 24 hours. It's shorter in sunlight. It's shorter if you have a detergent or a disinfectant of some sort. But the logic, if you're going to get a package in the mail, leave it in your entryway for 3 hours, and it should not be contagious. If something is plastic, then it might be a day that you're safe for. 2 days probably, because you want to have a little bit of a leeway in there. So leave it out there if you're worried, if it's a concern. So.
good?
And a lot of people Lysol, whenever they bring anything in the home that is plastic or metal, they just take a Lysol wipe and they just clean it all up.
Oh, that's very good. Thank you. All right. Anything else?
Not for me.
No? Eric?
Motion to adjourn?
All in favor? Aye. All right. Thanks, guys. Thanks for doing this.
Thank you.
Good to see-